All right, this video is going to be therapy for me, so I hope you like it. I'm going to rant and rave a little bit over things I see in the CrossFit community where I want to intervene and tell the participants and the coaches, hey, I see the effects of these bad exercises in my practice and you need to stop this right away. So what I mean by this is that people need to understand that the old adages of what doesn't kill you only makes you stronger and pain is temporary and championships are forever are completely false. And if you don't think I've been there, that I don't understand pain, you're absolutely wrong. I root for the Dallas Cowboys and the Texas Aggies every fall, so I know what pain is all about. But seriously, what I want people to really understand is that there's huge differences in what we'd call tendonitis or strain versus a disc injury. So tendon issues and strains, they get better over time. And quite frankly, even if they don't, there's little permanent damage. Take a quad strain or even tennis elbow. They're bothersome and they may take some time to get better, but they're not gonna break you down in the future and they're not gonna impact your overall health. A disc problem though, it's way different. You get a disc problem and it only gets worse with time. Over time, the disc is gonna break down, bone spurs develop, nerves get pinched, you have chronic inflammation that causes a low-grade pain almost indefinitely. So with that in mind, you can still push yourself really hard at the gym or at the CrossFit box, and you can do it for years, but you've got to avoid the most dangerous exercises. Now, if you're new to the channel, welcome. I'm Dr. Charlie Oliver. I'm a chiropractor and physical therapist practicing in San Antonio, Texas. So I'm still in the trenches and I'm there helping people with back pain, neck pain, shoulder pain, you name it. And on this channel, I'm here to share my experience with you and help you live a pain-free life. So on that subject, let's talk about the most comically bad CrossFit exercises. Now, the absolute dumbest exercise I've ever seen is a handstand push-up where the head makes contact with a pad or with the floor. This is almost comically bad. I'm not even going to do a demonstration of this because there's no safe way to do this exercise. Some athletes even use the momentum of their body to spring downwards before thrusting back up, putting even more pressure on their head and on their neck. Why? So over 10 years ago, I was actually at a CrossFit box and they wanted us to practice doing headstands. So there's absolutely no need to put your body weight on your head and your neck. No way. So matter of fact, while they were all doing that, I was standing there. I think I was doing some ab exercises or something like that. And of course, the coaches wanting you to participate, asking me why I'm not doing it. And I'm like, I actually work on necks for a living. Why would I do this? So anyway, if you're ever at some place and they want you to do either of those exercises, just politely decline. So this exercise goes in the CrossFit trash can. Next up on the list are snatches. Now, snatches are an established Olympic lift, so I don't want to say they're entirely a CrossFit move, but in my experience, having been to at least 5 different boxes in the past, each one of those had us do this exercise. So here's the thing with snatches. You get 2 for the price of 1. That's right. You get 2 chances to hurt yourself. So first off, just like with the deadlift, if you've seen some of my other videos, lifting a weight off the floor, you get a great chance at hurting your low back. That's number 1. So next, if you're doing a relatively lightweight and you're doing it for multiple reps, you're gonna lower it back to the floor. Guess what that lowering of the weight does? The motion of having your palm facing the floor while your elbow is at shoulder height or above, it pinches one of the rotator cuff muscles and is a great way to create rotator cuff tears. So there you go. You get 2 chances for injuring yourself for the price of 1. So let's take this exercise and toss it in the CrossFit trash can. Next up, overhead squat. I have no idea what the goal is behind this exercise. I've seen patients with back and hip injuries from this exercise. What on earth is this one about? So you're doing an isometric hold in the shoulder press position, but now your shoulders have got to be hyperextended and you've got to hyperextend your low back. Dumb. There is just no need for this exercise. Toss this one into the trash can as well. Last up on the list, box jumps onto concrete. Now, here's the thing. I think box jumps are great by themselves. Their plyometrics are wonderful for agility and explosive strength. However, what needs to be altered is the landing. I've been to boxes before with concrete floors, and at the time I was over 40. So to make things worse, besides just landing on concrete, when I was at the top of the jump, I would have coaches which would critique me and tell me, no, Charlie, you need to extend all the way and jump down from a fully extended position, because what I was doing is I would jump up and then I would keep my knees relatively flexed, trying to keep my center of gravity already as close to the floor as possible to reduce pressure on my body. And they're actually telling me, no, I need to be fully extended and be standing as tall as possible before I drop down Now, luckily, this is what I do for a living, so I knew I did not need to place extra pressure on my feet, my knees, my hips, or my back. So I just kept doing them like I wanted to. But I know a lot of you guys out there, it's kind of hard sometimes to say no to coaches. Other hugely problematic exercises are deadlifting, squatting, and power cleans. But for the sake of this video, I wanted to limit it to exercises really only performed in CrossFit. Now, I know I'm going to catch some arguments on this assessment, but all I can tell you is that this comes from hearing how my patients hurt themselves, and I don't think anybody should get injured while trying to better themselves. If you're working out hard and pushing your body, it should be for the long game, not a 2-month spurt only to get injured and be sidelined by injury. If you have comments or suggestions for a future topic, drop me a line in the comments, and if you want to argue with me, go for it. But be sure to like, subscribe, and hit the notification bell so you can stay up to date with the videos we release each week. As always, have a wonderful day and take care of your spine. It's the only one you've got.